Welcome to Healthy Living. Today we're going to be talking about the importance of having a primary care physician to kind of manage your care, to be your quarterback in your healthcare game and your journey. So I have two very special primary care physicians with me today from our own St. Tammany Health System. I have Dr. Hilaire. She is a family medicine doctor, and she works at our Folsom Clinic, the St. Tammany Physicians Network clinic in Folsom. So welcome. Thank you for coming today.
Thank you for having me.
Yeah, and welcome back, I should say, because you've joined me on several occasions, and I really appreciate your time. So you are a little bit new to St. Tammany Health System. It's been about a year now, correct?
Almost a year.
Yeah. Okay. So we're coming up on that anniversary. So just tell people a little bit about yourself and what inspired you to become a doctor.
Okay, so I'm originally from Natchitoches, Louisiana. I'm the daughter of wonderful parents. They're deceased now, but they introduced me to medicine. They drove medical transportation, so I was exposed to so many different people. I was exposed to hospitals, staff, and one thing that I remember that really intrigued me was that they had two children that were on the transportation van, and they were wrapped. And I said, "Mama, why are the mummies on the van?" And so at that time, my mom said they were burn victims. And I said, "Burn victims?" And I was like, "Well," I said, "So what happens next?" And so she started walking into the hospital, you know, kind of showing me around the hospital, from the staff at the door to the kitchen staff to the doctors, nurses, just talking to many people, get me exposed as possible because I was so interested. And then from there, of course, you know, you go through primary school, secondary school, but I worked with a pediatrician. I thought I was going to be a baby doctor.
Okay.
Before going into med school and kind of finding my way. So after graduating after going to Xavier and then getting into med school at LSU New Orleans and getting my public health and MD, I did a part of my residency. I had a compassionate reassignment because my mom was in the hospital. That's when I got really interested in how the heart functions. So she had heart failure due to chemotherapy.
Okay.
And after that, I transitioned into the military, and that's when I really figured out family medicine was for me.
Okay.
I like the well-roundedness of family medicine. And then after that, residency for LSU Bogalusa and then St. Tammany.
All right.
And so I'm happy. I love rural medicine. I'm a rural girl. I always tell people I'm a country girl at heart, but I do love the city and shopping. So that's me.
That's a balance. That's a good balance. I like it. So when you talk about family medicine and primary care and why it's so important, because you did talk about the little aspects of medicine that you saw, but then it all came together for you, right? Much like it comes together for the patient when they're talking about their own healthcare journey. And we do want to talk a lot about women and women of childbearing age and the importance of women having a primary care physician, but really it applies to everyone. Mm-hmm. And we kind of want to differentiate. A specialist is one thing, but your primary care doctor, you know, we're in football season, it's kind of cheesy, but we like to say you're the quarterback, right? Quarterback of the team. So tell me why that's important. What does that mean for especially a woman of childbearing age, whether they're planning a family right now or not?
So the quarterback analogy is actually perfect because it allows us to be at the center of everything. Although we can refer to specialists or secure message specialists about things that we need further evaluation on, we can bring it back full circle because everybody doesn't take care of the full patient completely. You might have a gynecologist or an obstetric doctor. You might have a cardiologist that's on the team or endocrinologist, but we bring all that back together to make sure the patient is fully being taken care of, properly reviewing medications, making sure we're taking care of that preventative health full circle, addressing any other like psychological things too. So it's a balance. We try to keep the patient balanced all around. It brings the patient back full wholeheartedly. So with primary care, it allows us to see them and do early detection of health diseases and illnesses and things like that through initial history and physical exam, just that simple. Knowing their history, knowing their social history, like of smoking, alcohol use, any history of drug use, you know, knowing their family history, or where do you work? Do you have any environmental exposures?
Yeah.
Medications they're taking, we review those things. We get lab work done, and it starts a little basic initially, just to get an idea of what's going on with the patient. There might be some imaging involved depending on what's going on, but it starts there too. And for women, we also do preconception counseling, because as you know, and you start this early when a young woman starts to have her cycle. You know, you want them to understand what's a cycle, and that having a cycle puts you at a higher risk of getting pregnant now, right?
Right.
Because your body's preparing every month to have a baby,
right,
for implantation of an egg. And so just starting at any visit, you can do it. It's not one visit, it's not every visit, but at any visit you can have these conversations. You can say, hey, are you even interested in having children? Are you interested in contraceptives? Or are you having problems conceiving? Do we need to get a specialist involved? So we are there to quarterback and get the ball where it needs to go.
Right. And so when you talk about all those kind of tests and early detection, because we like to say at St. Tammany Health System, educate, screen, prevent.
Right.
So what are some of those screening opportunities you can offer as a primary care physician that maybe a specialist could also, but if you come to your primary care, you can start with you.
Especially in rural medicine, accessibility is really important to our community. So we can, for our patients before the age of 21, even do pelvic exams, even breast exams, because some people may come in breast tenderness or breast abnormalities, or hey, I'm having some abnormal discharge, or my urine smells a little funny. So we can do a pelvic exam, and that's simply just taking a look. And then as they progress and get a little bit older, we start going into cervical cancer screenings. And those start at the age of 21, whether you're sexually active or not. And it's called a Pap exam, where we get a little sample of the cervix to see if there's any cancerous tissue or any tissue that can progress to cancerous tissue. And from 21 to 29, we do that. We don't do any HPV testing because that population normally can clear HPV during that time.
Okay.
But there can be additional monitoring and testing done. And then 30 to 65, we still do PAPs, but we add the HPV co-testing because the risk is a little bit higher and there's less chance of clearing. We can also do breast exams, and if you want that done, but breast cancer screening starts at age 40.
Okay.
And it can be earlier if you have a family history of someone that was detected a little bit early. Sometimes they say 10 years before.
And that's part of that counseling and coaching that you recommend.
Correct. So we kind of go through and we always educate them each appointment. Hey, tell us what's going on. This is a safe environment for you to be honest with us, because that's the best way for us to assist you and help you. It's not a judgmental environment. We're there to keep you the healthiest you can be.
Yes.
Especially when you think about women who want to have children. So let's keep you at a healthy weight. Let's make sure you're not on medication that can affect the baby if you're planning on having a baby. We start talking about what's the family planning idea? Is husband on board?
Right.
Has husband been checked if you've been having trouble? Things like that. We kind of go on. What are your chronic conditions? Is your blood pressure controlled? Your diabetes controlled? You have thyroid disease? Maybe we need to up your medication dose. If once you conceive, and are there things like that we can stay abreast of? Or your seizure medications? Do we need to transition that medication to something that's not teratogenic to baby, that things that harm baby? Or you're on folic acid to prevent neural tube defects? What are you doing? Are we having a good multivitamin?
Yeah. So all of that is preparing women especially for what may come in their future. And I want to touch on something, because you are really good at putting this, to me, you have a really good outlook on this. It's very important to be honest with your primary care physician, and then when you establish that relationship, it's a lifelong relationship.
Correct.
And people tell you things. They might tell you the truth, they might not.
Right.
But we encourage people to tell the truth to their primary care. And I like your approach when I've talked to you about this before, and you say, oh, somebody tells me I drink 18 beers, a day, and then what is your answer to that?
Sometimes I say, no, you're not supposed to drink 18 beers per day. And they laugh because they really do know that a lot of people know that they have a problem. And that's okay. And I tell them, it's just like somebody who eats too much candy, who eats too much food. But we can start. I say, let's reduce it by half, or let's reduce it by a third. I don't say, hey, just stop. You're a terrible person. I don't do that.
Right.
Because you have to be realistic in the management of a patient. Let's work together and get a reduction. And let's get to the root of the problem. Hey, tell me a little bit about what's going on. When did you start that habit? And so I ask those type of questions to get their rapport going. And sometimes I say, okay, with this, I want to see you back a little bit sooner. Let's do 2 weeks here and then 2 weeks again. And then we can kind of establish a rapport and say, how are we doing? And sometimes I say, hey, I did good last week, but then my brother came in or my sister came in. And I say, I can understand that we like to get together, laugh, and have fun. But as long as you're doing it in moderation. So I just remind them that we're human. We all mess up. I mess up. I tell people all the time, sometimes that ice cream bowl is too big, but it's my ice cream and I want it.
Right.
So, so we do, we're all human. And that's what I tell them. I say, so don't think that we don't mess up too.
Right.
We're right in the same boat.
So that primary care relationship, we kind of talked about if you're not ready to have a baby, you have that preconception counseling. You do a lot of things on the front end if a woman tells you, yes, I am interested in planning a family. Right. But then, you're looking beyond that too. You're looking at the whole outcome for the rest of that person's life. You're looking far ahead for their, and your issue spotting. So tell me about some of the issues you might look for to ensure that a woman has a healthy pregnancy.
So some of the things that we talk about, one, as I told you, just start basic, getting a history, finding out if they have any things that can prevent them from having a healthy pregnancy, like smoking, alcohol use. What's their weight? Do you have a healthy weight? Because sometimes we can be too low in weight or we can be too high in weight, and you want to make sure the baby has good nutrients and everything. We talk about screening for sexually transmitted diseases too, to decrease the risk of passing that to the child, because they can end up with different types of diseases and maybe affecting their vision and hearing and things like that. We talk about appropriate immunizations like Hep B, MMRV, Tdap, because kids' pertussis was on the rise, in the recent years. So we want to make sure they're covering the kids too. So we try to get like a full picture of making sure they're healthy and making sure they know, like, hey, is it a year or 2 years? Do you need contraceptives until you decide to be pregnant? Hey, when you decide or when you start conceiving, let's transition those blood pressure medications to something that doesn't affect the baby. Let's transition those diabetes medications to something. So we talk about all those things. And then a new topic is people having bariatric surgery. We want to make sure they're not getting pregnant while they're having a rapid weight loss. We want them to be at a steady weight, to have a healthy pregnancy. So kind of delving into those things because, you want to address if they're having fertility concerns or not. So you want to keep it full circle. So I always start from the basics. Hey, having a conversation like we're having,
right,
and then kind of progress on to the their history, their medication management, their screenings, all those things. So
okay, well, I appreciate you once again coming in and talking to us about this. I love the way you frame things for folks, and I think people appreciate that. Is there anything else you want to add about this topic or what you do in general, anything at all, before we wrap up with you?
I want to say that regular checkups are important. I know some of us think we're very healthy, but sometimes our normal is not normal. Okay. So come and see us. Come and see us in Folsom, come and see us in Covington, come and see us in Madisonville. Make an appointment. Even if you feel uncomfortable, just come talk to us. Give us a chance to take care of you and your family.
Okay. Well, thank you once again for being here with us. And we are coming right back, and we will talk more about primary care in your healthcare journey.
Surfing your symptoms again? While the internet knows a lot, it doesn't know you, and it certainly doesn't care about you. Get your primary care from one of our many primary care physicians. Doctors, not AI. Backed by a team of specialists at St. Tammany Health System. Same-day primary care appointments available.
Welcome back. We are going to continue our conversation about primary care, and we're focusing today a lot on women's health and women of childbearing age and beyond for primary care. But really, your primary care doctor is your quarterback, no matter if you're a man or a woman. So I'm bringing back one of our primary care physicians, Dr. Caitlin Ladner. She is a family medicine specialist, and she's in our Madisonville clinic. So thank you so much for joining us today.
Thank you for having me.
Yeah. So we were talking with Dr. Allaire. We talked a lot about women's health, the focus on it. And we want to talk, we talked about childbearing years. Let's kind of shift the focus. Well, actually, first, I'm remiss. Let's talk about you a little bit.
Okay.
Tell me a little personal tidbit about you so that our audience can get to know you.
Yeah, sure. So I was actually born and raised in this area. I grew up in Mandeville. I went to St. Scholastica for high school. So it's just been a pleasure to come back home. I went to LSU for undergrad, and then I went to William Carey for med school, which is in Mississippi. Okay. And then I did my residency in Bogalusa, so not too far away, but still not home. So it was nice.
Right.
It's nice to come back, take care of the population I grew up in.
And how is that? I mean, you have to see a few familiar faces now and then.
I have, yeah. I've seen some people from high school. It's nice.
Yeah.
I like it, yeah. I like seeing familiar faces.
Do you see any people that knew you when you were a little girl? And they're like, oh my gosh.
I don't. I know a lot of people, I've seen a lot of people that know my mom and probably know who I was when I was a little girl.
Right.
But as far as like, yeah, and I don't think any from when I was a kid.
Yeah, so it's probably
sure it's
really
coming,
helpful.
though.
It's helpful to be in your own hometown and your community, and you're familiar with the lifestyle we lead in South Louisiana.
That's right.
Right, and so that's helpful. And like I kind of alluded to earlier, we focused a lot on the childbearing years, for women and primary care and how important that is. So let's now shift gears and talk about as a woman goes throughout her life and in every stage of your life, right? Why it's important to have your primary care physician.
So what I think is really awesome about primary care, and I guess specifically family medicine,
Yeah.
is that we take care of people, of all ages. So if I'm lucky enough to stay in Madisonville for the remainder of my career, I could have taken care of someone, from when they were a child through their puberty, speaking of women, through their childbearing ages, into their menopause, possibly.
Right.
So it's just really awesome to take care of them throughout all the stages of their life.
And you kind of, I would imagine, and you can correct me if I'm wrong, when you establish a relationship with anybody, you're looking at their whole life's
Absolutely.
healthcare in a holistic kind of way.
Yeah.
So what does that look like, sort of?
So just, from head to toe, making sure, they're on the right medications for what they need, making sure they're having the right prevention screenings, making sure that they're doing all the lifestyle changes that they need to stay healthy. So yeah.
Yeah. So, and in women, I know a lot of things we talk about with women's health, and some things that maybe women don't pay attention to as much as maybe men, or maybe they do. But high blood pressure, that is always a risk,
Yep,
right?
absolutely.
And heart disease. So those are two. Now we talk about women's health. We like to, we like to hit home, educate, screen, prevent as far as breast cancer awareness
Right.
and, cervical cancer and things like that. But heart disease and high blood pressure are also contributing factors to women's health journey. So tell us about that. Like, where does that start with a woman?
So, from when they're kids, honestly, we start screening blood pressure. We take it at every well child visit. And then, into adulthood, we're checking their blood pressure at every visit to make sure that they're in the right range that they need to be. Cholesterol screening kind of starts a little bit later on. For women, if you have any cardiac risk factors, which could be obesity, smoking, alcohol use, any family history, which is pretty important around here.
Yeah.
We screen a little earlier, so around age 30, which is pretty pertinent for, childbearing age. If you don't have any cardiac risk factors, we screen a little later around the age like 40. But we actually screen for cholesterol, that's what I'm talking about, cholesterol, in kids as well. So between the ages of 9 and 11, and then again between the ages of 18 and 21. And then if you come see me as an adult, you aged out of pediatrics, for example. If you don't have those screenings done, then I would screen you for that at that point as well.
Okay, so I want to touch on two things. So blood pressure and it's important. You said we do it at every visit, and every visit I've ever been to, absolutely my blood pressure's been taken. What is the problem when you have blood pressure that's either too low or too high? How does it impact the rest of your health in your body?
So if it's too high, it can eventually start causing issues with your arteries, leading to things like heart attacks, strokes. If it's too low, you can have issues like syncope, where you pass out. You're not perfusing your organs enough, so you can eventually have some organ damage. As far as high blood pressure, it can eventually cause kidney damage, can cause issues with your eyes. So a lot of different things that high blood pressure can cause.
And when we're talking about women specifically, I know that high blood pressure can be problematic in childbearing
pregnancy.
years. Yeah. So
Right,
how does that
exactly.
affect, your pregnancy?
Yeah, so it can lead to preeclampsia, which is a very severe issue during pregnancy, where you can eventually have seizures.
Wow.
You become eclamptic, and it would be a medical emergency and cause early, you'd have to deliver early. So yeah, it's definitely something that we take very seriously, especially in the childbearing age. If you are looking to get pregnant, we monitor that pretty closely.
So now let's go back to that cholesterol part, because you said you test in children as well. So that's kind of surprising to me. I didn't realize that.
Yeah,
and I
we
have 4
screen.
children. I didn't even know.
Yeah.
So why? Why do you do that in children?
It's just preventative.
Okay.
Yeah, so we're looking for early issues early on, especially, since childhood obesity is on the rise. It's important to keep an eye on these things. And a lot of cholesterol issues are familial. They run in your family.
Okay.
And so it's a good idea, especially if you're high risk. You have cardio risk factors in your family, we're going to take a closer look at things like that.
Okay. So you talked about when you look at someone's cardiac health, the whole picture, it's their lifestyle, it's their habits, it's their family
Absolutely.
history. For instance, my dad, I think he was in his 50s when he had his
Yeah.
first heart attack.
So that puts you at high risk.
Exactly.
Absolutely.
So what would your advice be to someone who is at high risk? And that, I guess, speaks to the importance of establishing that relationship, right,
Right.
with your primary care.
Yeah, so you have to find someone that you trust that can have these conversations with you, because they're not always easy. You know, if you have someone that comes in that is obese or that does smoke or drink alcohol, I know Dr. Ayler had touched on that a little bit, but it's important to get those risk factors down, because those do contribute a lot to high blood pressure. So helping people quit smoking is important, helping people lose weight, which can be a tough conversation to have with a lot of people. Making sure that they're staying active, you know, any kind of cardiovascular, weight training, anything that they can do to keep moving is important for blood pressure. So yeah, just touching on those preventative things that they can
Right.
do. Diet is really important. So something like a DASH diet, watching their salt intake, which is pretty difficult in the South,
Right.
especially Southern Louisiana, where we love our food. So yeah, it's important to just monitor those things.
So would you say, and I guess how would you say, that part of your role as the primary care physician, as the quarterback, is how much of that role is counseling and coaching on how to stay healthy, how to maintain your health?
Yeah, I would say probably the majority of the time that I spend with patients is spent counseling. I really try to look for lifestyle modifications that they can participate in. I mean, if I have a patient that comes to me and their pressure is in that 120, 129 range, which is technically elevated blood pressure, it's not hypertensive.
Right.
You want to prevent them from getting to that next stage. So you really want to stress the importance of dietary changes and weight loss and stopping smoking, all the things that we just touched on, just to get them out of that danger zone that they're in.
So that's part of what you do.
Absolutely.
Yeah.
Yep.
So what is your kind of favorite age group? I think I've heard you talk about this before. Who's like your favorite age group?
Okay, well, my favorite age group is geriatrics. So I really enjoy the elderly population. Yeah, I thought about doing a geriatric fellowship, but then I got pregnant and, you know, my life carried on. But I do enjoy the geriatric population.
And what is it about the geriatric population that you enjoy?
I just like how they have no filter, honestly. They speak their mind. They're also pretty, I'm going to say difficult to care for, because you have to kind of walk this fine line between doing too much and not doing enough, if that makes sense.
Yeah.
You know, you have a patient that's 80 years old that's on a high dose statin, like they don't need to be on that medication potentially. And so that's something that you can probably pull off. Or as you age, your blood pressure does get higher, but as you get older into your geriatric population, sometimes your blood pressure drops, and then you have to come off of some of those blood pressure medications. So they're just challenging.
Yeah,
but they're also fun.
Challenge and balance. Yeah. So if I come to you as a patient, if anybody comes to you as a patient, and you find something along the journey that requires a specialist intervention, talk about how that occurs. What happens from your kind of perspective?
Okay, so for example, I had a 40-year-old that came to me who hadn't seen a doctor in 20 years, who was having headaches and had really high blood pressure. So he ended up being in kidney failure.
Wow.
Yeah, from this long-standing hypertension issue that he had.
Thank goodness he came in.
Yeah, so I had to coordinate care, you know, with the renal team, making sure that he got where he needed to be. And of course they coordinated with like renal transplant teams, and now he's on the transplant list. But, you know, it's about getting him set up with a cardiologist to make sure that his blood pressure is much more controlled than it was.
Yes.
You know, that's someone that it's probably out of my scope, and he needs the care, the extra care, you know, and it's great that we have an awesome cardiology team to help manage these more difficult patients with uncontrolled hypertension and potentially uncontrolled cholesterol.
And you touched on something. The health system as a whole, you have a lot of support to rely on and relationships. And so that's an important part of primary care at St. Tammany Health System in particular. So I think the specialist part is very important, because I don't know if people understand that you are there to lay the baseline for health care, issue spot, counsel, but if there's something that is, like you said, kind of beyond your scope, you have the resources to pull someone else in and get them better.
Yeah.
So
and what's nice is that we have a close communication with all of our specialists, so we're able to, you know, personally call and see if if I have someone that really needs to get in,
Yeah.
I'm able to get them in when they need to be seen.
Okay. Well,
Yeah.
is there anything else you want to add at all about the relationship with your primary care doctor, whether you're a woman of childbearing age, woman beyond childbearing age years, or a man in the community?
I would just say it's important to find someone that you trust. I think that's a big part of, finding the provider that's right for you. I hope that I create like the environment that a patient would want to come in and have a conversation with me and tell me everything that's going on so that I can better treat them.
Yeah, because like Dr. Alaire, I mean, you're not there to judge the person, right?
Absolutely not.
You're
Yeah.
there to like help them make their lives better.
Right.
Yeah, so that's good to know. So you're not a judgmental doctor.
No. Definitely not. I do also want to say that medications are important for blood pressure, especially in, women don't think about birth control itself. If they're on a form of birth control that's higher in estrogen, it can cause issues with high blood pressure. So and ibuprofen, that's something
Oh, really?
that can cause elevated blood pressure if they're taking it enough. Like women who have premenstrual cramping, things like that, they're taking pretty regular ibuprofen to help get through those periods.
Okay, that's
And so
interesting to
That's
know.
important.
Yeah. Okay, well, thank you so much for being here, Dr. Ladner.
It's fun.
I appreciate you coming in and talking with us about this important topic. And thank you for joining us on Healthy Living. We will see you next time.